Thank you, and good afternoon, everyone.
I'm honored to be here on the traditional territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. For many British Columbians, the past several weeks have been enormously challenging. We have experienced some of the most damaging flooding in our province's history. Now, in partnership with all levels of government, we continue to make headway on our recovery. This is in large part due to the strength and resilience of British Columbians and their local leadership who are supporting each other and taking the challenges head on. Today, I'm joined by Minister of Health Adrian Dix and Dr. Bonnie Henry, the Provincial Health Officer, who will be speaking of yet another threat to our collective safety, the COVID-19 Omicron variant. The province has been monitoring the rapid spread of this variant both here and at home and abroad, and the Provincial Health Officer will be announcing further restrictions today to help curb the spread. Our government continues to investigate supports for those who are or may be impacted by these new restrictions, and the Provincial COVID-19 Working Group met today to discuss this very thing. And as Deputy Premier and the Minister of Public Safety Solicitor General, I'll be working with Ministry staff to ensure that these new measures are properly enforced. Given the increases in cases we are experiencing, we need the public to do everything they can to slow the spread and to avoid any further burden on our healthcare systems. Compliance with these restrictions is key, and it's our collective responsibility. Earlier today, Emergency Management BC and the Minister of Transportation and Infrastructure also issued a news release about upcoming severe winter weather. A series of strong storms will clash with cold Arctic air across BC through the holidays. Periods of heavy snow, freezing rain, and very cold weather are likely in many parts of BC between now and New Year's Day. We need to be ready, to be prepared for extreme freezing temperatures and risks to our still vulnerable highways, especially Highways 3, 5, and 99. I urge British Columbians to place close attention to weather forecasts and road closures. Focus on weather alerts for your area from Environment and Climate Change Canada. It is vital that we not only look after ourselves, but after each other as well. Dress for the weather. Ensure you and your loved ones have enough food and supplies, check on vulnerable neighbours, and above all else, be safe. People experiencing homelessness are especially vulnerable in extreme temperatures. We're making sure the availability of warm, safe places to stay during the cold and wet weather. This winter, the province is providing more than 1,900 temporary shelter spaces and nearly 360 extreme weather shelter spaces. That's a 25% increase in the number of shelter spaces over last year. These emergency shelters supplement more than 2,250 permanent year-round shelter spaces currently open across the province. The extreme weather response shelters are available when a community issues an extreme weather alert. All communities have issued this alert ahead of the coming cold snap. For everyone, where an extreme weather alert is issued in your community, it is important to dress in layers with a wind and water resistant outer layer, cover as much exposed skin as possible by wearing hats, scarves, and gloves, and to stay dry and change out of wet clothing as soon as possible. Again, British Columbians must be mindful of these added challenges in the coming days, and if possible, stay home and out of the weather. Lastly, I want to take this opportunity to thank the First Nations and local governments who have been vital in keeping our communities together through both the recent storms and the ongoing pandemic. The work crews who have made tremendous progress working day and night to repair our damaged highways, especially the Coquihalla. And the many healthcare providers who continue to fight COVID-19 day after day here in British Columbia and across the country. And with that, I'll now pass this update over to Health Minister, or over to Dr. Henry. Thank you.